Oh my god, I can't even grab the scalpel properly. Okay, let's cut his stupid leg off. Ah! I stabbed his intestine! Oh my god! Let's start now. Okay, so we're gonna talk about the appendix. Look at that. What is the appendix? The appendix is like a tubular structure that's over here on the... You see it on the large intestine on the right side. So large intestine is also known as the colon. This would be the right side. We're like facing a person, right? This is the right, this is the left. The appendix is here on the lower right side of the abdomen. So it looks like a little uninflated long balloon. So what does it do? What does the appendix do? A lot of people say that it does nothing. That's actually we were taught that since childhood. I was always told the appendix does nothing, and it's both true and both false. It's both true and false. So actually, some people say the appendix is not really fully understood. So, because people say it doesn't do anything, yet it does have a purpose. It actually has a purpose. It doesn't really do anything, but when you remove it, nothing happens. Basically, it's not a needed organ. Many people made studies about the appendix, and recently they discovered that it helps fight infections because the appendix, although it's a tiny worm-like organ attached to the right side of the colon. It has a lot of what we call the lymph nodes or lymphoid tissues. Lymphoid tissues are those that the parts of the tissues of the body that have a lot of white blood that produce the white blood cells, like the if you watch Cells at Work, you know, the neutrophils and the lymphocytes. Yeah, that. So that's what's in the appendix. There's a lot of that, but see, everywhere in your body there are lots of parts of the body that have lymphoid tissue. So even if you remove the appendix, you'd still be able to produce lymphoid tissue. So the most common disease of the appendix is acute appendicitis. This is like the most common surgical abdomen in the world. I think it's in the world. I see it all the time in the hospitals. Anyone who complains of abdominal pain, like if a person complains of abdominal pain and they bring you to the ER, the doctors in the ER will always think about either you have diarrhea, depending if you've been having diarrhea, watery stools, or vomiting, and they will also have at the back of their mind acute appendicitis, because it's really common to have this. So here, this is a acute appendicitis right here. So it's really small. In general, it's small, but some people have really long appendices. So it may be tiny. Like I said, it's like a little tiny appendage attached to the large intestine, but it can be deadly. And it can be very, very painful when you have acute appendicitis. So do not trust this cute appendix. It can give you hell. Okay. So, symptoms of acute appendicitis. We have the most common is abdominal pain. When you have acute appendicitis, usually it would start on the middle of your abdomen and then it migrates all around until finally it stops at the right lower abdomen where the appendix actually is. And other symptoms, if it ruptures, it would be pain all over the abdomen, as in all over. Other symptoms of acute appendicitis is also vomiting. Well, sometimes not all patients will vomit, but they will feel nauseous. So they will feel nauseous or they will vomit. Some people don't feel nauseous at all, or some people don't vomit. There would be loss of appetite, like sometimes some doctors would ask the patient, do you feel like eating a burger? That means that's how to test the appetite of the patient, if they really want to eat a burger or not, or if they're hungry. But most of the time they don't feel hungry at all. They don't want to eat. Okay, another one is fever. But not everybody has fever when they have acute appendicitis. Okay, so yeah, like I said, the most common or the major symptom of acute appendicitis is abdominal pain. That one will be like 99% compared to the other symptoms, because sometimes people don't really vomit, sometimes people don't have the fever. So aside from all the symptoms, when you go to the hospital, there are some tests that the doctors might order or do. When you're seen in the hospital, when you go to the ER, the doctor will order some tests. So one of the tests is a CT scan, which is in our country, in the Philippines, it's pretty expensive in government hospitals. So, but in tertiary hospitals, they'll order this. I think it's protocol in some hospitals. If there's abdominal pain, they gotta do a CT scan. If a CT scan is not done, they will do an ultrasound. Now, ultrasound is like the ones they do for pregnant women, but they look for your appendix, and they can see the appendix through the ultrasound. Another test that they will do is blood test. So they will take a blood test. Usually the blood test they take is called a complete blood count, or a CBC, and that's where they'll check if your WBC is elevated or high, and they will look at the number of neutrophils in the blood test. So in acute appendicitis, you'd have a lot of white blood cells. Aside from the blood test, they will also do a urinalysis. So if they suspect, they do a urinalysis just to rule out UTI, because in some people, when they press on the abdomen, and then they have pain, sometimes it's just UTI, because UTI can look like appendicitis when actually you just have a infection in your urine. Here in the Philippines, appendicitis can be diagnosed without a CT scan and an ultrasound. Sometimes the doctors will only ask for a CT scan or an ultrasound if they're not sure. But if they are sure that you have appendicitis, just by asking you what happened and by pressing on your abdomen, if they're sure, they will not order the CT scan and the ultrasound anymore. They'll know, because most of the time acute appendicitis you can diagnose it just by asking the patient what happened or his history, and by pressing on his abdomen. So let's go to the stages of the acute appendicitis. So appendicitis is not just simple appendicitis. It has stages. It has there's 4 stages, which is actually the 4 stages are divided into 2. We have the uncomplicated and the complicated. The uncomplicated has 2 stages, and then the complicated has 2 later stages. So let's go. So we have the uncomplicated appendicitis. This is the congestive stage. Congestive. Basically, the appendix is angry. It's larger than normal, and it's just red. Like when you have red tonsils. It's just that. It's just big and red. Now we go on to the next one. The next stage, or the second stage of the appendix, is the suppurative stage. Suppurative meaning there's pus. So it's basically an angry appendix with pus. So think red and yellow. It's red and it has nasty pus around it. It's usually bigger than the congestive appendix, but it's grosser looking. Okay, the next are the complicated appendicitis. The first part of the third stage, which is under complicated, is the gangrenous stage. Gangrenous appendicitis. This appendix is discolored. Most of the time it's purplish or gray, or sometimes even brown. It's disgusting. It's gross. You can see in this blurred picture that there's like a brownish discoloration or a black discoloration. This kind of appendix smells bad. It smells pretty bad because it's like a dead necrotic organ. Okay, moving on. So after the gangrenous appendicitis, we have the final stage, which is the ruptured appendicitis. It's basically the same as the gangrenous stage of appendicitis with all the discoloration, but now that it burst. And when it burst, you would have all the pus and all the shit coming out of the appendix and scattering around the abdomen. So this is the kind of appendicitis we don't want to happen, but it happens anyway because some people just tolerate their abdominal pain. Or I don't know, some people just they have high tolerance for pain and they don't know that their appendix ruptured already. Treatment for acute appendicitis. So all of you know that when you have acute appendicitis, you need a surgery. But actually, there are some studies or some cases where they are able to treat appendicitis with just antibiotics. Especially through the IV line. Like they would admit the patient for a few days, give the patient IV antibiotics, and then send the patient home. If antibiotics fail, that's when they move into surgery. But then, some doctors believe that, if you have acute appendicitis, just do a surgery, just operate on it. Because even if you give antibiotics, it could happen again, and they would end up with a surgery anyway. So yeah. Okay. Anyway. Next. So, surgery. There are two types of surgeries for acute appendicitis. And the first one is the open or traditional appendectomy. So, when you say appendectomy, it basically means removal of the appendix. So, you can actually, if they say something, an organ plus ectomy means removal. So, now you know. When they say appendectomy, it means removal of the appendix. In the open or traditional appendectomy, they have different kinds of incisions. So, most of the time, it's on the right lower abdomen where it's a straight line. Sometimes it's smaller. If the surgeon feels very confident that he can get the appendix in a very small incision, he would make one. But usually it would be horizontal like this, or sometimes it's a little slanted. If they consider a ruptured or a complicated appendicitis, sometimes they would have the incision here. They would cut you here, below the belly button, right here in the middle. So, or sometimes, like in the olden days, some surgeons would have the cut here, like in the middle of this and this, a longitudinal cut right here. There's another kind of appendectomy, which is the laparoscopic. This one is more expensive because unlike the previous one, what they would do is give you 3 incisions, like really tiny incisions, one at the belly button, one on your left side, and one here where you're on the lower abdomen. And then they would put the camera here on the incision and the belly button, and then they would take it out by looking at the monitor. Like, this is technology. And then they would use these 2 instruments to get the appendix, cut it out, and then take it out from here. This is more expensive because of the technology used. But most of the appendectomies done here, at least here in this country, is the open or the traditional one because it's quick and easy, and it's less expensive because we have a lot of people who can't afford a laparoscopic appendectomy. The next disease of the appendix, which is this is actually rare. Cancer of the appendix. You can actually get cancer in the appendix. And it's very similar to the symptoms are very similar to the acute appendicitis, but probably the difference is the formation of cancer is a lot more gradual compared to appendicitis. Appendicitis is like almost a few days. You'd have it. Cancer would take months to years. The only time you'd know that it's cancer of the appendix is after the histopathology of the appendix comes out. Once they remove your appendix, they send it to the lab to identify what it is, because sometimes it could just come out it could be cancer. It might not be appendicitis at all. Anyway, for when you have a cancer of the appendix, the treatment is always surgery. Cancer is always surgery, aside from chemotherapy. So, depending on the location of the cancer, because the cancer can be at the tip of the appendix. If it's at the tip, you can just remove the appendix, which is appendectomy. But then if the cancer is like in the middle of the appendix or like near the base or near the colon, you'd have to remove the entire right colon. And I think that's the last slide. Yeah, that's the last slide on appendix. Do you guys have any questions? This ends our lecture on appendix. It's very short. Okay, Surgeon Simulator. Okay, I have not played the first Surgeon Simulator, actually. To be honest, I have not played the first one. But then when I saw, I was going to get the first Surgeon Simulator, but then when I saw that this was coming out, I decided to get this, especially since it's co-op. It's what is this? Diagnostic scanner? What? No Bob found. Where is Bob? Ah, it's Bob. Oh my god, I'm stepping on his body. What? Rip his right leg off. Why is he still moving? I'm standing on his body. Hey, wait, maybe we can see his appendix here. What is this? Why is this? What? Why is it blue? Is there a saw? Or do I just rip his leg off? What? Ah, there's a scalpel right here. A scalpel. This is Mesokun's brother. I'm actually having a hard time. Okay. Ah! I grabbed the whole tray. Ah! I can't take the scalpel. I can't move. Okay, move that. Move that out of the way. Okay. Oh, there we go. Haha! But I'm holding the scalpel weirdly. I'm holding it weird. Oops. No, let's cut. This is not how you hold a scalpel, but this will work. How do I cut this? Oops. What? I already cut his leg off? Did I? I did not cut his leg off yet. I feel like oh my god, I can't even grab the scalpel properly. Okay, let's cut his stupid leg off. Ah! I stabbed his intestine! Oh my god! Okay, let's cut this stupid... Ah! Okay guys, this is a disclaimer, but this is not how you do surgery. But this works. How do I get his leg off? I can't... Oh my god! I got his leg! Oh my god, it's dying! It's dead! Okay, stay in there. Ah, okay. This new leg. This leg looks funny. Oh my god. Aha! Let's pop his leg on. Okay, how do I plug his leg back on? Ah! It fell right in! Haha! Okay. Now what? Am I done? Give it red syringe. Ah, okay. Okay, let's oh my god, I stabbed him on his thing. This is how you I just transfused blood on him. Okay. Oh my god. So I have to do an organ transplant. Oh my god, how many lives does Bob have? Like I detached his leg, I pulled out his intestines, I detached his leg and his arm, and he's still alive. Can I pull his head off? Okay guys, this is not how you do a thoracic surgery or a chest surgery. I actually have to crack the ribs on this guy. Okay, am I done? Can I rip his ribs off now? Okay. Remove old lungs. Ah, okay. Okay. Oh no. I might... Ah! How am I going to... Aha! I got his lung. I got his lung. Okay, get those lungs. Ah! Okay, let's do that again. I can't. How is he supposed to breathe without his lungs? Okay, yeah. Aha! Okay, let's get rid of those. Let's give him new lungs. These are new, right? Let's put those. Yahoo! Let's put lungs. Oh my god! You just dropped the lungs in, and that's a transplant already. Okay. Can do attitude. Aha! I have completed. I am a black lady. Hello. Oh my god. Ah! Oh my god! I'm teleporting. Ah!